8 ways to overcome your nightmares. Have you ever been startled awake in the middle of the night? Maybe your palms are sweating and your heart is racing as you remember, or try to remember, a disturbing dream that felt all too real. If that's the case, you've had nightmares. Nightmares are unsettling dreams that wake you up from sleep and may include abnormal movements, behaviors, emotions, or perceptions. They can happen while you're sleeping, falling asleep, or even waking up, says Raj Dasgupta, M.D., a sleep expert and assistant professor of clinical medicine at the University of Southern California's Keck School of Medicine. Nightmares are most common in children, but they can occur at any age, and the occasional one is usually nothing to worry about. But if they occur frequently and your daytime functioning is disrupted due to lack of sleep, it's important to seek treatment, according to Dr. Dasgupta. Try these tricks to get rid of nightmares so you can get a better night's sleep. Number 1. Find your inner peace. Stress is a common nightmare trigger. They sometimes result from us trying to solve problems in our sleep. This is the brain's rehearsal system at work at night, says Alex Dimitriou, M.D., founder of Menlo Park Psychiatry and Sleep Medicine in California. Find activities that help you relax and incorporate them into your daily routine. Meditation, yoga, walking or another form of exercise, a hot bath before bed, or scheduling a few minutes of quiet me time to wind down from the day are all good options. Number 2. Have a snack before going to bed. According to Jacob Teitelbaum, M.D., integrative medical expert and author, if your blood sugar drops too low while you're sleeping, it can be a nightmare. How can you tell if your bad dreams are caused by a nighttime hangover? If you're hangry during the day, that's a good indicator. A simple treatment for this is to eat 1 to 2 ounces of protein before bed for a few nights. Think 2 hard-boiled eggs or a small amount of meat, fish, or cheese, a glass of warm milk, and avoid carbohydrates, which may aggravate the problem, says Dr. Teitelbaum. Number 3. Maintain a regular sleep schedule. Maintaining a regular sleep schedule 7 days a week, yes, even on weekends, is essential for getting enough rest and, as a result, avoiding nightmares. Dr. Dasgupta advises, sleep deprivation and insomnia have been linked to an increased risk of nightmares, so try to stick to a regular sleeping pattern as much as possible. Each day, go to bed and wake up at the same time and try to get 7 to 8 hours of sleep. Finding a sleep routine that works for you, such as putting away electronic devices 30 minutes before bed or reading a few chapters of a book, can make it easier to fall asleep. Number 4. Get rid of the nightcap. Dr. Dasgupta says that while alcohol and other substances like drugs can make you sleepy, it can also cause nightmares. Examine your medicine cabinet. Avoid drinking wine, beer, liquor, and other spirits close to bedtime and instead rely on other tricks to calm your mind, such as a soothing cup of a hot tea or 10-minute meditation. Number 5. Examine your medicine cabinet. Depression and anxiety can be a nightmare trigger, but so can some of the drugs often prescribed to treat those conditions, such as SSRI, selective serotonin response inhibitors. In fact, SSRI may actually intensify dreams, says Michael Breus, Ph.D., clinical psychologist, diplomate of the American Board of Sleep Medicine, and fellow of the American Academy of Sleep Medicine. Other drugs to treat blood pressure or help you sleep may also cause nighttime distress. Talk to your doctor about alternative medications or adjusting your dose to see if that helps. Number 6. Try rewriting your nightmares. Dr. Breus says that if you can recall what you dreamed about, image rehearsal therapy may help reduce nightmares the next time you sleep. Transform your nightmare into a peaceful story. For example, if you were running down a dark path as a threat approached, imagine yourself walking down a quiet wooded path with your faithful dog following. Number 7. Schedule worry time. You're probably aware that stress, anxiety, and depression can result in nightmares. Carving out time to feel and experience those negative thoughts and emotions may help you keep them under control. That way, you won't bring them into bed with you. Journal or problem solve for 20 to 30 minutes before bedtime to get it all out so it doesn't happen in the middle of the night, Dr. Dimitriou advises. Number 8. Stay away from scary situations. This may seem self-evident, but watching a scary movie or reading a scary book can cause nightmares, so take a break or hit pause to see if they go away. This may appear silly, but it isn't. I know I had a nightmare the night after seeing The Invisible Man a couple of weeks ago. Dr. Dasgupta agrees.